Hi, my name is Kevin Moss. I'm a senior editor with Consumers Checkbook. We publish Checkbook's Guide to Health Plans, which helps federal employees and annuitants choose the right FEHB plan. Today we'll talk about what we know so far about changes to FEHB for plan year 2026. OPM released 2 carrier letters earlier this year. Let's look at the impact of each. This letter is issued at the start of the year, inviting FEHB carriers to submit their benefit and rate proposals for the following plan year. It also outlines OPM's policy goals and initiatives. Here's what's new for 2026. OPM cites a KFF survey that found 58% of people with health coverage encountered at least one problem using their benefits in the last year. To improve the FEHB program for enrollees, OPM has focused on the following 3 initiatives. While most in-network claims are filed directly by providers, enrollees must typically submit out-of-network claims themselves, often requiring them to print and mail a form. OPM is requiring carriers to implement an online claims filing process by the end of 2026 to supplement mail-in submissions. Carriers are already required to offer online provider search tools. Beginning next year, carriers must also include a homepage link directing users to a search tool that allows filtering by the following: provider name, practice or group name, location, network status, gender, specialty, areas of focus, language, acceptance of new patients, and telemedicine services. Carriers with multiple provider networks must clearly indicate which search tool corresponds to each plan. FEHB enrollees have the right to request reconsideration of benefit determinations from both the carrier and OPM. Currently, details about the disputed claims process are outlined in the official FEHB brochure. By January 1st, 2026, carriers must also make this information easily accessible on their websites with a fact sheet that includes a clear description of the disputed claims process, including members' rights to request reconsideration from both the carrier and OPM, required deadlines for submitting reconsideration requests and disputed claims, a straightforward explanation of how members can obtain copies of the materials used in the carrier's decision-making process, and a link to all necessary forms for filing an appeal online. Currently, all FEHB carriers must fully cover preventative care services recommended by the U.S. Preventative Services Task Force. Beginning next year, OPM will require all plans to cover all FDA-approved pre-exposure prophylaxis or PrEP medications for individuals at increased risk of HIV at no cost. There are 2 fertility-related updates for next year. First, HMOs operating in states with IVF coverage mandates must include benefits complying with those requirements. Second, individuals at risk of iatrogenic infertility due to medically necessary treatments, such as chemotherapy, will gain expanded benefits for cryopreservation and egg or sperm procurement. For next year, OPM is encouraging carriers to further expand their mental health provider networks to ensure timely access to care for plan members. If an in-network provider is not available within a reasonable time frame for mental health or substance abuse disorder services, carriers are asked to increase access to out-of-network providers at in-network rates. The annual call letter included 3 pages of instructions for carriers to enhance obesity management benefits next year. However, an addendum issued after the call letter removed this requirement, citing changing priorities. The addendum to the annual call letter was prompted by 2 executive orders issued by President Trump. The first defending women from gender ideology extremism and restoring biological truth to the federal government. And the second, protecting children from chemical and surgical mutilation. Under the first executive order, carriers for plan year 2026 must list only 2 gender options, male and female, with no third options or gender identity requests. The second executive order mandates that all carriers exclude coverage for pediatric transgender surgeries and hormone treatments for gender transition. This policy applies to covered dependents under the age of 19. Because of this benefit reduction, OPM has directed carriers to incorporate corresponding premium reductions into their rate proposals. Carriers may continue offering gender-affirming care services to individuals aged 19 and older, but they are not required to do so. OPM allows carriers to propose additional plan benefits for plan year 2026, provided that they comply with applicable laws and guidance while ensuring the best possible coverage at the lowest cost to plan members. Carriers must submit their benefit and rate proposals to OPM by May 31st, 2025. I will continue to provide updates if any additional OPM policy changes arise. As always, federal employees and annuitants should carefully review their plan options this fall to ensure their FEHB plan continues to meet their needs. Thanks for watching. Please like and comment so more federal employees and annuitants can find this video, and make sure to subscribe to our channel to receive alerts on future videos.